Within our bodies, a delicate balance ensures everything functions correctly. But what happens when this balance is disrupted? Video shows a title card, Amyloidosis, an explanation. An animation follows, depicting normal proteins folding correctly, then transitioning to show abnormal proteins misfolding and clumping together into fibrous structures. Proteins are the building blocks of life, performing countless vital jobs. Normally, they fold into specific shapes to do their work. However, in a group of rare diseases known as amyloidosis, certain proteins change their shape, misfold, and clump together. These abnormal proteins, called amyloid, form insoluble fibers that can accumulate in various organs and tissues throughout the body. This buildup disrupts the normal structure and function of the affected organs, leading to a wide range of health problems. The specific type of amyloid protein and where it collects determines the type of amyloidosis and the symptoms that follow. Video transitions to show an anatomical overlay of a heart, highlighting amyloid deposits that cause the walls to thicken. The view then shifts to the kidneys, showing similar deposits disrupting their structure. A shot of a person looking visibly tired and showing swelling in their ankles appears. The symptoms of amyloidosis can be subtle at first and often mimic those of more common conditions, making it difficult to diagnose. As amyloid deposits accumulate, they can cause significant damage. If the heart is affected, a condition known as cardiac amyloidosis, symptoms may include shortness of breath, fatigue, an irregular heartbeat, and swelling in the legs and ankles from fluid retention. When amyloid builds up in the kidneys, it can impair their ability to filter waste from the blood, leading to kidney failure, which is characterized by swelling, fatigue, and changes in urination. Other common signs can include severe fatigue, unexplained weight loss, numbness or tingling in the hands and feet, and easy bruising. The varied and non-specific nature of these symptoms often means that individuals see multiple specialists before the underlying cause is identified. Video depicts a doctor compassionately examining a patient, listening to their heart and checking for swelling. This is followed by animated visuals of a blood test tube, a urine sample cup, and then a microscopic view showing amyloid deposits in a stained tissue sample. Diagnosing amyloidosis is a multi-step process that requires careful evaluation. The journey often begins with a thorough physical examination and a review of the patient's medical history. If amyloidosis is suspected based on the symptoms, a series of tests will be ordered. Blood and urine tests can detect the presence of abnormal proteins, which can be an early indicator of the disease. However, a definitive diagnosis requires identifying the amyloid deposits themselves. This is typically achieved through a biopsy, where a small sample of tissue, often from abdominal fat, bone marrow, or an affected organ like the heart or kidney, is taken and examined under a microscope. Using special staining techniques, pathologists can confirm the presence of amyloid and perform further tests to determine its specific type, which is crucial for guiding treatment decisions. Video shows an animation of medication molecules binding to and breaking down amyloid proteins. A final, hopeful scene shows the patient looking healthier, having a positive conversation with their doctor about their progress and future management. While there is no cure for amyloidosis, significant advancements in treatment have transformed the outlook for many patients. The primary goal of treatment is to stop the production of the abnormal amyloid-forming proteins, prevent further organ damage, and manage the symptoms. The specific approach depends on the type of amyloidosis. For some types, chemotherapy or targeted therapies are used to destroy the cells that produce the misfolded proteins. Newer medications have been developed that can help stabilize proteins to prevent them from misfolding or assist the body in clearing existing amyloid deposits. In cases of advanced organ damage, supportive care is essential to manage symptoms and maintain quality of life, which might include medications for heart failure or dialysis for kidney failure. With ongoing research and personalized treatment strategies, we are continuously improving our ability to manage this complex disease, offering more hope and better outcomes for those affected.